Hello everyone. My name is Jeffrey Rivera, and today, for the assignment, I decided to further look into and talk about substance disorders and mental illnesses. So, to begin with mental illnesses. Mental illnesses are disorders that um, are either caused by things from emotional childhood trauma, verbal abuse, um, emotional abuse, and among many other factors, can cause a person to have like symptoms of severe mood swings, not feeling well, and disrupt their overall quality of life in terms of them not being able to do things that they normally otherwise would have been able to do just fine, such as uh, going out to their friend's house or going out to the movies or um, perhaps uh, even something as simple as walking the dog. And then for substance use disorders, as the name suggests, that typically involves the continual abuse of a substance by an individual in which, they may be, excessively consuming things such as alcohol, um, vodka, or any other um, substances that are harmful to the body when consumed in excess, and that in of itself can, adversely affect a person's quality of life by putting a strain on the family because while under the influence uh, of a substance such as alcohol, the affected individual who's abusing the substance, might behave differently than they would otherwise and might experience mood swings, unusual behaviors, and among other things. But luckily, though, both mental illnesses and substance use disorders, while serious, are though still treatable, and recovery is typically possible, of course, for most people through different means, such as getting in touch with a community health worker who can refer a person with a substance use disorder, for instance, to a substance and an alcohol and abuse uh, drug alcohol counselor. And then for mental illnesses, of course, one thing that a community health worker in that particular situation could suggest would be, you know, having them and the afflicted family members who are, constantly headbutting with the person's mental disorder and their behaviors, which may be interfering with the quality of life and the relationship. A good referral that a community health worker could refer them to would be family therapy and an individual therapist or psychologist for the individual with a mental illness, because then they will be able to find out the root causes and underlying causes of the mental illness. Thanks.